Assalamu alaikum. Welcome to another episode of Second Home. Today's program is all about cancer, its awareness and prevention. We are having an in-depth conversation with Dr. Shushobna. Her mission in life is to fight cancer, is to create an awareness, is to get the fear of cancer out of people's mind. Because cancer is something that can be cured. It's not the end of the world. We hope by the end of this program, you'll see cancer for what it really is, and you'll know that you can survive it.
সকালে বিকেলে রই আদরে ওহরে ওহরে ঘুরে 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 কি খুঁজে কাহারে ফুলে রই পাহাড়ে নরম নরম সকালে বিকেলে রই আদরে ওহরে ওহরে
We're in conversation with Dr. Shushobna, who is an oncologist and works with the government hospital here in Kuwait at the Cancer Hospital. Welcome to our show.
Thank you.
This is a pleasure to have you here, and we're doing this episode especially to raise awareness about this dreaded disease. Could we start by you telling us what is cancer?
Cancer, what is cancer, right? Actually, it's a big topic, and I think this 15-20 minutes will be very less to speak on cancer. But being an oncologist, what my message will be regarding cancer is, it's a disease where the cells are growing in an uncontrolled way. It's not from an infection. It's basically a genetic change which is occurring in the cells, and that is causing the cells to grow abnormally without any control. And those cells develop a propensity to travel through the blood circulation and the lymphatics, and this abnormal growth is basically cancer.
You know, one thing I've heard about cancer that was a little technical, but one thing I've heard about cancer is that there's stages. So there's stage right up till 4.
Yeah.
And that's the most dreaded stage.
Yeah. The stage, basically, it's important for us in making the treatment protocol. Like when we get a cancer patient, it's not like cancer. We first, as an oncologist, we would like to know the patient is coming to me at which stage. In any cancer, we have actually from stage 0 to stage 4.
Okay.
So stage 0 means where it is in situ stage, means it is localized to the same tissue, and they generally have a very good prognosis. They are cured fully. And up to stage 2 also, stage 1 and stage 2, these are all based on the size of the tumor and how much it is involving the surrounding structures, the lymphatics. Based on that, we have stage 1, 2, 3, 4. Stage 4 basically is a stage when the disease has spread to any other organs of the body. So let's say for a breast cancer, if it has gone to the bones, breast cancer has gone to the liver, then we call it stage 4.
Up till what stage you don't have to do chemotherapy?
After which stage you don't have to do chemotherapy?
Like in the sense, stage 2 requires chemotherapy?
Yeah, it depends on stage 2, how big is the tumor and what intent you are taking. Like for say, supposing a breast cancer patient with a big lump and you want to preserve the breast. You don't want to go for a surgery in which the patient will lose the breast, mastectomy. In that case, we do give chemotherapy to downstage the tumor, to reduce the size of the tumor, and then the patient goes for a surgery where she can preserve her breast. We go for a surgery which just removes the tumor.
I've heard a lot about chemotherapy, and I know that we lose hair in chemotherapy, but I don't really understand what it is. Is it a medicine that you eat? Is it like a radiation that is given to your body? What treatment is chemotherapy exactly?
No, I think you're confused 2 3 things. Basically, in cancer treatment, we have 3 things: surgery, chemotherapy, radiation therapy. Surgery, it's removal of the tumor.
Okay.
Chemotherapy, it's basically a drug which is given in injectable form,
Okay.
like infusion, or it can be even tablets. We have chemotherapy tablets also. And radiation is totally different. It's like high radiation, gamma rays we call, that radiation that comes like a light which is put on the tumor mass, and that reduces the tumor size or kills the tumor cells in that area. So these are 3 different things. Chemotherapy, we decide based on the stage what chemotherapy am I going to give. And again, if the chemotherapy I'm planning something, again we see most of the chemotherapies are basically IV, which we give intravenous, like a drip.
Okay.
The chemotherapy is put inside a drip, like normal saline or dextrose saline, and that the patient gets just like a drip, as we get a drip. And there are some chemotherapies which we can give the patient as oral tablets. Patient can take it at home.
I see. What is the reason behind cancer? Like, is there a way we can prevent it completely?
Yeah, there are 2 questions actually. I'll try to answer you. Actually, if you ask me what's the cause of cancer, it's really a difficult question, because so far, for most of the cancers, we don't have a direct cause. Like, you cannot say this breast cancer is because of this. But basically, we have multiple risk factors, which if the patient or if that lady has been exposed to for a long period of time, then those risk factors make the cells change its genetic makeup, and those cells then change into a genetic propensity which it develops and goes in for carcinogenesis.
Right.
There are some cancers, like say lung cancer. There is a type of lung cancer which has direct relationship with smoking.
Smoking, yes.
Here you find in Kuwait it is common actually that smoking for a long time and a number of cigarettes, like who are heavy smokers for say 10 years, 15 years, they generally have a propensity to develop a lung cancer. Not only lung, smoking can cause actually cancer starting from the oral cavity up to the rectum. It can cause almost any sort of cancer. So smoking has a high propensity. Along with that, if a person is alcoholic also, that increases the propensity to develop a carcinogenic change in the body. Yeah.
So I like what you said about, to understand this, I like what you said about causes and risk factors. So there's not a direct relationship. You can't say this causes cancer.
Yeah.
But these things increase your chances of getting
Developing.
cancer.
Yeah.
Interesting.
So like for breast cancer, basically the main motto is, or main take home message is, if any lady is exposed to high estrogen level for a long time, she has a high propensity to develop a breast cancer. Now, what is estrogen? We know the feminine hormone is estrogen. So any cause which is making her exposed to estrogen for a long time, like who is nulliparous, who doesn't have a baby for a long time, she's menstruating every cycle. So every menstrual cycle, her estrogen is high in the body. Okay, another lady who is on pills for a long time, contraceptive pills, most of the pills, though presently the pills that are coming are reducing the level of estrogen, but basically pills are all heavy doses of estrogen pills. Similarly, ladies who are going in for in vitro fertilization treatment, so they also have a high risk of not only breast, ovarian cancer also. And one more thing I should tell you, we are discussing only ladies. Breast cancer is not limited to females only. Breast cancer occurs in males as well.
No,
And we have a big number of patients.
That.
Yeah, we have a big number of male breast cancer patients also. Yeah.
In terms of awareness, what is it that laymen can do to make themselves more aware?
Yeah, this is a very good question. See, actually, in the full world, we know that we are all afraid to hear the term cancer.
Yes.
Once we hear cancer, we think it's
end
done.
Of the world.
This is very wrong, because cancer does not mean death. Death is not that easy.
I like how you put that.
Yeah, death is a difficult term, and surely cancer should not be blamed like cancer means death. No, surely no. Then we all oncologists, or so many developments in oncological hospitals all over the world will not take up if cancer means death.
Right.
What is scary in cancer is that cancer, even if it is treated to the best possibilities in the present days, there is chance that it can recur. Now, you'll ask me what is recurrence. Recurrence means cancer coming back. So, the next step will be why cancer recurs back. So, cancer will come back if there are some cells of cancers remaining back in the body. When does this happen? This happens if the patient, when was first diagnosed with a cancer, the tumor mass was big. So the tumor, it took some time to grow in the body. During that time, some cells might have traveled through the bloodstream or the lymphatics into some parts of the body. We give the chemotherapy basically to kill those cells. But there is no guarantee that I am able to kill all the cells that have traveled all throughout the body or wherever in the body.
Because it was at a later stage.
Yeah. So if I have killed all those cells, then surely that person or that lady is very less likely to come back with a recurrence. But there are cases where they have come late and the chemotherapy was delayed or the chemotherapy was interrupted. In those cases, some cells remained back and they generally have a high risk to come back with a metastasis. Metastasis means some recurrence somewhere else in the body. Now, awareness term. This awareness means if I think that I can pick up a cancer early, then this risk of recurrence goes off. Means that person can be cured to the best limit and the chances of recurrence will be nil. So the main thing that we as oncologists want to spread for everybody in every nooks and corner of the society is that never think that cancer cannot come for me. Think that cancer can come for me also. Then you will not be diagnosed late. The thing is, we never want to think if there's an ulcer in my body, I never want to think this can be a cancer. We always want to think that person's had a cancer, she had a cancer. Why not me also? So if you are developing some abnormal lump in the body, if there's an ulcer in the body which is not healing, if there's a bleeding in the gum which is not getting cured with your dental care, think of there is something wrong maybe going on. See an oncologist, get diagnosed early, spread the message.
So the advantage is a double advantage here. Not only if you diagnose it early, then not only there are chances of you getting cured this time, but also that the recurrence won't be there.
Yeah, sure.
Which is great. I like your message about keep
and we also
being
say,
aware.
if diagnosed early, we say though you are diagnosed with cancer, you are not going to die from cancer. That's the main important
that
thing.
must be a huge challenge, right? I mean,
Yeah.
to be able to tell, how do you tell your patient that you've got cancer? Because like you said, it's equated to death most of the time. So it must be a huge weighing down on your soul too, on your spirits, day in, day out, meeting a cancer patient. How do you motivate them to live? How do you get them to be optimistic about their future?
Yeah, that's actually a very important and deep-seated question. Basically, when we study oncology as students itself, we are taught that there's a topic called breaking the bad news. There are two incidences when we have to break a bad news. Once the first diagnosis, when the person will be diagnosed with a cancer, you have to break the news that this pathology is showing you have a cancer. So we are taught that you will not open it just like that, come you have a cancer. We don't open it that way. There's a scenario, we call the relatives, we call the patient, we ask the relatives how much you have told the patient, how much the patient knows, and how do you think that if I open the bad news, how much the patient is going to tackle, how is the reaction going to be, should I open the full thing or no? It's good that the patient should know that he or she is being diagnosed with a cancer, because he or she is the one who is going to get the treatment. So basically breaking the bad news should be with the patient, but we set up a scenario with the relatives where all the close relatives of the patient will be there, and then we slowly come into it like unfortunately though we have got a diagnosis that you are running with a cancer, and then slowly we tell them again which stage, what treatment are we going to give, and we try to keep all good hopes with the best options available. We'll try our level best and we'll keep everything else to the good God to take care.
That is very beautiful. What about patients who you consider that may not have a chance to survive? How does that situation, does it?
It's the advanced cases, right? Yeah, there are in our profession almost every day you have one case which is progressing badly, and then the treatment is not working, and you have to tell the patient and the relatives that maybe more further chemotherapy or hormonal treatment or any other further oncologic management as such is not going to work. We do have to, many times it becomes difficult for the relatives to understand the situation or to take it, but somehow or the other, slowly, multiple times we keep talking to them, because in oncology we have a limit. We cannot keep giving a treatment one after the other if it is not going to do something good. There are situations when we find the cancer is too resistant to treatment. Whichever chemotherapy you are going, it's not acting. The patient is progressing. So in that case, we say it's a resistant type of cancer. It's not working with the treatment. And then we have to declare the patient for best supportive care.
Doctor, one question I had is for our audience, if you could do this. Now, I understand for breast cancer awareness, there is a procedure where you can do a self-examination, maybe your friends can do it. What is the right way to examine yourself? Could you...
For the ladies,
can a lady do this by herself, or does she need a friend to help her out?
No. We call self-breast examination. That should be the take-home message for today's talk. Like every lady should have a self-breast examination once in a month. It should be, say, 7 days after the last day of the periods.
Okay.
And she should make it a particular day in her calendar, that which day she has to do it every time. And she should do it regularly and it in a very cool scenario, like where she is not tensed. And there's a particular method actually. There are like some examinations which tell them, like with the right hand she examines the left hand, the left hand she examines the right hand, and she has to examine herself in sitting position as well as in lying down position. She also has to examine the underarms, because there are cases where we get the cancer in the underarms but there is no lump in the breast, but it's a cancer from the breast which has gone to the underarms. So she has to examine herself, and if she finds any change in her breast look, she has to know anyway. At the beginning she has to know what is the normal look of her breast. So anytime she finds that one of the nipple is getting inverted, or breast is getting pulled up, or there is any puckering of the nipple, or there is any scaliness around the nipple, or there is any red color discharge from the nipple, or there is any obvious lump in the breast, all these things, anything unusual which she has not seen before, she has to contact her doctor. Sure.
Doc, one thing I'd like to know is, recently we've come across a lot of videos on, WhatsApp is very popular these days. We get lots of videos and articles about how cancer is not necessarily a disease, like it's some vitamin deficiency, that scurvy was also a deadly disease once, but finally they found out that it was just vitamin C deficiency, and so is cancer. Is there any truth to that?
Actually, researchers always, we have to pay respect to them, but until it is fully proved, we should not take it for granted. And basically, as we know, cancer is a genetic change. It's a change in the DNA which is causing uncontrolled growth of cells, tissues. So that is actually, that uncontrolled growth of cells is actually a malignant or a tumor growth or malignant growth. But till we get into something documented, we should not take it for granted.
Doctor, there's so much more I'd like to know, but other than that, there's one very personal question that I'd like to ask you, is how do you manage this? I mean, I'm sure you've got probably crazy timings at work and so much more taken from you in terms of time and effort for your patients. How do you manage your family life with your career? And I believe you also mentioned you have to attend conferences for further studying, and it's an ongoing thing. So how do you manage all that?
No, actually, it should be we should feel thankful to good God that you always have a family support, and being a wife, being a mother, it's surely a big responsibility at home. But I've always got my full support from my husband, my kids. We do have night duties, we do have multiple calls, and it's very tensing in the hospital also. So many issues. But somehow or the other, he's with us and he helps us. And we keep
do you have
doing.
a hobby? I think
Yeah.
I heard a Tweety Bird tell me about your singing.
Yeah,
You know
I
what,
do
you'll
love
have to
singing.
sing for us then.
Yeah, I do sing. यूं जिंदगी की राह में टकरा गया कोई, यूं जिंदगी की राह में एक रोशनी अंधेरों में बिखरा गया कोई, यूं जिंदगी की राह में टकरा गया कोई, यूं जिंदगी की राह में.
Wow, that was beautiful.
Thank you.
Wow. I'm surprised. You've got a voice like a profession. You know, this could have been your alternate profession, you know, if you want
Thank
to
you so much.
That was
Thank
great.
you so much.
Thank you so much for talking to us. This
Thank
was
you.
so useful, and I hope our audience, you found this useful too. I'd like to, give you a message from our oncologist. You heard your doctor. Examine yourself every month possibly, and stay healthy and happy. Doctor, any last
Don't
message
keep
for
a
you?
fear. Be prepared that even if it's going to be a cancer, get diagnosed early so that don't have a fear of dying from cancer. That's all. Thank you so much.
ঘুরে 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 কি খুঁজে কাহারে ফুলের ওই পাহাড়ে নরম নরম সকালে বিকেলের ওই আদরে ওহরে ওহরে ঘুরে 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 কি খুঁজে কাহারে ফুলের ওই পাহাড়ে নরম নরম সকালে বিকেলের ওই আদরে ওহরে ওহরে.
Let's now talk to a cancer survivor, Mrs. Antoinette Rodriguez. Welcome to our show.
Welcome. Good evening, everyone.
Good evening. We'd like to know about your experience with cancer. We spoke to the doctor, and the doctor told us that generally people associate cancer with death. How did you find out that you have cancer, and how did you first take it?
Yeah, one fine day, one evening, I just had a shoulder pain, and when I just felt why my shoulder was paining, I found a lump under my arm. So I was wondering from where this lump came up, and I just hanged on for a few, say an hour, and it started giving me severe pain. So as normal thing, you have something, you apply some liniment. I did that. After 2 hours, I developed fever. So I consulted a friend of mine who's a nurse, and she said it's better you come in the morning to the hospital, we'll do some check. So the next morning, it was Ramadan time, I cannot forget. Can't drink, eat. So anyway, I went to the hospital, Amiri, and there I got they looked at myself, the doctor, and said, okay, now we need to do immediate X-ray and mammograms. So I said, okay. So the X-ray showed some things which medically I don't know. And they moved out to me to a mammogram department. There, it was quite painful, the mammogram. And just after the results, the doctor referred to KCC. So I wasn't aware about what was KCC. So my friend said, no, better you go to your doctor and he will forward it to you.
Did you have someone with you then?
That day, the first day was to go to the hospital, my friend took. So the next day when I went to my clinic, that's not clinic, the Al-Rashid hospital for allergy. When I went alone, I normally had no one to take me. Took a cab, I went alone and showed my papers. When the doctor saw the paper and he said, you come with anybody? I said, no. Why? So he said, you have to go to another hospital. So I told him, what is it? He said, you have to go to a suburb building called KCC. So I said, this is chest, that is KCC is good cancer. So am I developed now cancer or it's something to do with the chest? I said, I can't say anything. Are you with any? I said, no. I took a taxi, I went there. Immediately, they made a file and series about 4 doctors came in and started examining me and they said, well, you have to be operated. For what? You have a breast cancer. You will have to remove your breast. Are you prepared for it? One moment I thought, I was shocked.
Obviously.
Alone, shocked.
Yeah.
Then, yes.
It must have been so scary.
Not really, because I've gone to a couple of surgeries, so that was one more added to it.
Okay.
So I didn't mind. So I said, okay, let's do, okay, I will. So get your hospital recommendation that you're not allergic to certain things and you're not an you're asthmatic. Okay, done. I went back, got a referral letter, came back to KCC the 3rd day, and when the doctor examined me and I started having heavy breathing. Now I was very tensed up. I couldn't tell anybody what was really happening to me. The doctor said, okay, now you are going to be operated, you're going to get admitted, but your chest is bad. Go back to your hospital. So from one hospital back to another hospital. There I got admitted and I was given a week's time to get all right from my asthma to come back for the surgery. I was very scared what's going to happen and I said, okay, I'm not doing the surgery now. I go back home. 3 months later, I came back confidently that, okay, this is an additional 20th surgery of my body.
20th?
Go ahead. Yeah, I've done 3 more after that.
How long ago
Total
is this?
25 surgeries.
How long ago did you find out about your breast cancer? Yeah.
2007, 2008, I was operated.
I see.
Then I was told, okay, we'll remove your breast. It'll be a big surgery. Then after that, you'll have to go series of treatment. Before that, they did biopsy, which was extremely painful, but I took it. After biopsy, the surgery took place. I came out with a very flying car. I was supposed to be in the recovery room for 1.5 hours. I was brought back in an hour's time. That's Almighty God has taken care of me.
Wow.
After that, I had 4 chemos and 26 radiation. And from 2008 up till now, I am still under treatment because I have osteoporosis. But in that period, I have hats off to all my doctors in KCC. They gave me all the courage, my family. And I would suggest everyone or anyone who comes to hear it is cancer, don't be afraid. Be positive thinking. Take it. It has come, it will come. All of us have cancer. That's what I know. When I was in hospital, I read So it erupts anytime. So don't be
Afraid.
of it. Be positive. You can get, and mine was second stage, so I got. And today I'm as normal. I had a year back an accident, which I have female, broke with the steel rods. Yes.
25 surgeries. Wow, you're like this live superwoman now. Wow.
That's all his will that I have to do for somebody, and let everybody believe that sickness comes, sickness goes, but don't be afraid. And family should support.
Yeah, I was going to come to that. What do you think is the most important aspect of recovering from cancer?
Most important is family support.
Family support, yeah.
And take your treatment in time. I have friends who have not taken their treatment and the cancer has erupted. I was very blessed with good doctors, and I praise in God to them. They give physiotherapy and they give me instructions. Do your exercises, take your medicine, be happy. Don't think about, just live happily. That's what I did.
That's a great message. Being happy. I think that itself takes a lot of...
But you need support.
Yes.
And positive
Happiness
thinking.
comes from...
See, even my leg, I was 1 month in Razi. Well, okay. I couldn't walk, wheelchair and walker, all that. But I was determined that I will not take support from anybody. I will walk.
You're a strong
I will walk
woman.
and you walk. And I want everyone to be strong like this, not like me. Everybody can't. But you have to have the will to fight your illness.
Yes.
Anything you can get through.
Great message.
Anything.
Great message.
So
Thank
all
you
the
so
people
much.
in Kuwait or anywhere in the world, don't be afraid. Cancer is for everyone. It comes in different forms. Here, tongue, nose, anywhere it will come. But don't be afraid.
Yes.
If it has to come, it will come and it will go.
And it will go.
But when you know something like that, as doctor said, go, see, don't feel, I don't want to go to that hospital. I don't, no, don't do that. Go.
Go. Do what's important.
Do what is, you will survive. Survive like me.
Great. Thank you so much for talking to us. This was such an inspirational story, and I wish, and I know you were mentioning about how you've made this kind of you want to be an inspiration to others, and the way you can do this is by spreading the message.
Yes.
And you want to come out, and is that why you came out today?
Today, yes, because I want, and I am helping in socially and in not in the government thing, but in my community, in my whoever needs help. And I always tell them, don't get frightened. Don't be afraid. Things come, things will go. We live once, so take it.
Has this has having cancer changed you in any way?
Yes, it's taught me a lot of willpower to fight yourself out. Fight and face whatever comes in front of you. Face it. But it takes a little more strength physically and mentally. You have to be strong. And that you pray to God.
Thank you so much for talking to us. It was our pleasure, and you are quite an inspiration for everyone else.
Thank you.
Thank you so much.
Thank you.
Thank you.
This brings us to the end of this episode. Sadly, we had only enough time for this much, but we hope this episode was informative, was educational about how cancer can be prevented, how cancer should not be feared. The message I got was to stay healthy. And some of the things that we could do to stay healthy is a healthy lifestyle, which includes taking a walk, eating healthy, make sure you avoid processed packaged foods. These days, children would love to eat processed food, but as responsible parents, you need to make sure your children are not eating junk. Like I said, take a walk, breathe fresh air. These are some of the things you can do to maintain a healthy lifestyle. Make sure to add a walk a day. Until next week, from the team of Kuwait TV2, stay healthy.